All right, guys, we're going to get started. Housekeeping, if you go right here, there's a door that says bathroom on it. If you got to go to the bathroom, that's where it's at. You got to go through that door and then through another door. You'll figure it out. Coffee and bagels in the back. Feel free to get up during my talk to go get some more food and coffee. That's fine. This is a really interactive workshop. So if you guys have questions as we're going along, then make sure you stop me, ask questions. All the stuff that I'm going to go over should be very straightforward. My goal today is for you to walk out of here with enough information about your low back pain to make a decision about what to do. Some people in here probably don't even have low back pain. How many people in here have low back pain right now or have had it within the last 30 days? Okay, so fair number of people, right? So some people don't have any. This is an educational format, so it's going to be interactive. I'm going to ask you to do a couple things as we're going through. But at any time, if you have any questions about anything at all, then make sure you feel free to stop me and ask me some questions. So what you guys have there, two really important things. This is a book that we're going to go over a little bit later, that spiral bound thing. Inside of your folder is this worksheet. So this is really for me. It keeps me on track, or else I'll talk for 2 hours. So we'll kind of fill this out as we go along, and we use this as a tool to educate you guys about how low back pain works. The most important thing that you need to know, and what it says in the topics here, is how to get your spine to last 110 years. Does anybody believe that their spine can last that long? Okay, great. All right, we've got optimism in the room. That's what I want to hear. Most people kind of laugh when I say that, but the spine, when used properly, really is designed to last that long. Unfortunately, there's a lot of information out there that says it's not. Almost everybody has low back pain at some point in their life. So if you talk to anybody over the age of 65, what do you think the percentage of people that have had low back pain at some point from 0 to 65? What do you think that percentage is?
Probably 100.
Pretty close to 100, okay? It's very rare that you talk to somebody that's, 65 or older that hasn't had some kind of back pain. Some more severe than others. Some have had surgery for their back. Some have thrown out their back. Have you guys ever heard that term? We hear that a lot in the office, right? But it's ubiquitous. You can't go through life without having low back pain. So it's really important that people learn how to use their spine. So that's the problem. You didn't get an instruction manual when you were given your spine, right? If you go get a piece of electronic equipment or like a new toaster or something, even that would have some kind of instruction manual to teach you how to use it. You guys didn't have that. So my job is to kind of educate you on how that works and give you in the next 45 minutes the instruction manual and some tools that you'll have to work on at home to make sure you know how your spine works, and when something goes wrong with it, you know what to do. So the three things that you need to know in order to get your spine to last 110 years. Right? So if you don't remember anything else I tell you, this is the most important thing. Okay? And it's all covered in the book that I gave you guys. But the first thing is neutral spine. Everybody know what neutral spine is? Yeah? What's neutral spine?
It's where your head, shoulders, and your tailbone all are aligned.
Wow, this guy is doing some research. That's awesome. Okay, so pretty close to that
program.
Yeah. Yep. All right. So neutral spine. Think of it as good posture. Everybody knows what that is, right? You were told. What did your grandmother say to have good posture?
Sit up straight.
Yeah. Yep. Sit up straight. Right. It's not that far away from that, but I'm going to teach you a way to measure that a little bit better. So neutral spine is no matter what position you're in, standing, sitting, walking, moving, bending. If I have a pole and I put it on my back, it would touch in 3 spots. Okay? It would touch my tailbone, in between my shoulder blades, or we call that the thoracic spine, but kind of your mid-back in between your shoulder blades, the back of your head, and the space between this pole and your low back is the width of your hand. So that's really important. So the width of my hand is different than the width of your hand, is different than the width of everybody's hand. So that space there is the width of your hand. This is neutral spine. I'm in neutral spine. Now, it doesn't take much to get out of neutral spine, right? not much. So it's education on how do I do that. And it can't be just standing, right? So when I go to bend over to pick something up, I've got to be able to maintain that. Right? Bend, squat, lift, move. So now this looks pretty easy for me. But if you've never done this before, and I say go from standing to sitting, I've never once seen someone be able to do it that's never done it before. So I put this pull on your back, stand here, and then just sit. And keep those 3 points of contact. I've never seen it. Okay? So what is important to know is that there's a lot of things that go on with maintaining that. So there's muscle shortnesses, like tight muscles, weaknesses, but really it's just the mechanics of knowing that where your spine is in space. Okay? So I know where my spine is in space all the time because I've done this for years and years and years. Most people don't. So that's one of the most important things we teach you if you come in for physical therapy. So neutral spine. Next thing that you need to have because your spine will last 110 years is proper hip mobility. Let me know what that is if I say hip mobility. Just how much movement occurs at your hip. So does it make sense that if my hips are tight, so usually hamstrings, right? Anybody can like bend over and touch the floor when they go to bend down? Yeah, some people can, some people can't. But that's one reflection of, or one measurement of hip mobility. But if I'm a neutral spine and I bend over and my hips stop here, if I want to go further, where does that motion have to come from? It has to come from my back, doesn't it? So this is what most people do. So a lot of people think they're moving their hips when they do this, but they're not. They're moving their spine, right? So the difference between that and this. So I bend over, I can get to here, and all of that motion is occurring in my hip. So these hips are ball and socket joints. They're huge joints that are designed for motion. The joints in the spine, these little facet joints that are back here, are designed for motion, but not large-scale motion, especially under load. Okay? So if I have this neutral spine and I'm not picking anything up or I'm not doing anything super aggressive, I can get away with that for long, long periods of time. But as soon as I get out of neutral spine and then I add load, like I go to pick something up, then I'm going to have trouble. Okay? Using your hips and having proper hip mobility is really important. So hip mobility. And then nerve mobility. Let me know what nerve mobility is. It'd be really impressive. Let me know what this was. Right. Yeah?
The ability for the nerves to slide back and
Oh
forth.
my goodness, I planted this guy up here. Okay. All right, you're going to come up and do the next talk. I got another one. We got one at noon, and you're going to do it. Yeah, nerve mobility. How well does a nerve move back and forth in the path that it travels? So that's kind of complicated. But if I bend forward, and I can't bend forward anymore, it could be that my hips are not moving properly. I've got tightness in the muscles in my hips, or maybe even the joints. Or it could be that when I get to here, the movement of my sciatic nerve stops. It's like stuck. It's like glued in the spot that it's at. That can cause pain, numbness, tingling, burning, and we're going to get into that. But those are the three things that you need. Neutral spine, good posture. Hip mobility, your hips got to move. Nerve mobility, the nerves, mostly the ones going down the back of your leg, have to glide back and forth in order to take that pressure off of your spine. Okay? And we're going to quiz you at the end of that, so remember that. I'll even leave it up here. You probably can't read my writing, but I'll leave it up there for you. Okay, so now we'll go to your sheet here. So, you know, why Rob's rehabilitation and how did I come to kind of specialize in spine health? When I was in college, I played football, and I had 2 herniated discs in my lumbar spine. So I had severe back pain, and it stopped me from what I wanted to do. So that's kind of the start of where I kind of got into. Now I was going to physical therapy school, so I knew I was going to be a physical therapist, but I kind of focused my career on the spine for a lot of reasons. One, I've had that problem, and I've gotten over it, and I want to help other people with it. And 2, it's just so common. It's so common in our society to have back problems. So I'm going to focus on something. I want to focus on something that's going to have a huge impact. So I got out of school. I worked for a bunch of different places. I'm unemployable. I can't work for somebody else. So I opened up my own practice. And when we first started out, I would see patients. I was out of school. I thought I knew everything, right? So my patients would come in. And my success rate with spine, when I first started, looked something like this. About 25% of the people I saw, they did great. I did program with them, came 6, 8, 10 times, got rid of their back pain, they loved me, they wanted to adopt me as their next son, right? About 50% of people got better, but they didn't get everything they wanted out of physical therapy. They didn't achieve their goals. If you come in for physical therapy, the most important question we ask you the first day is, what are your goals in physical therapy? So most people say, well, I want to get rid of the pain. That's pretty easy to do in most circumstances. But what is the pain stopping you from doing? Well, you know, I can't like get down on the ground and play with my grandkids or my kids, and because my back hurts, and it's kind of stopping me from doing the things that I want to do. So I got rid of the pain. They got better, but maybe they didn't achieve all the goals they wanted to do. And about 25% of people that I saw, no matter what I did, I didn't make it any better or I made it worse. And so I'm a pretty competitive guy. These statistics are not very good. So I'm not happy with that. And one day, yeah, on your sheet here, it says Super Day for MTI. So one day, this guy comes into my office, and I drops off his resume. My secretary's up front. Say, hey, this guy dropped off a resume. You guys know much about resumes? They really don't even have resumes anymore. It's supposed to be like one page, right? That was kind of like 20 years ago. They keep everything on one page. This guy's resume, 4 pages, single space, 10 font, front and back. All the stuff that he had done. So at the time, we were like, well, you know, our success rate is not that great. This guy was a professor. He taught at different schools. He said, maybe we should try to hire this guy. Really couldn't afford him at the time, but we hired him part-time. And we said, all right, maybe we can learn some stuff from him. So I'll never forget this first day, just like this setup, bunch of tables along the wall. So it's me, and another PT that I had, and we're treating patients. And all day, I see my patients on the table, and they're kind of looking down at what Dave is doing at the last table. And I was watching what he's doing. I didn't know what he was doing. And my patients are doing this different stuff, manual therapy type stuff that we'll talk about. And my patient said, "What is that guy doing?" And I said, "Oh, it's physical therapy." He says, "Well, I want that." And I said, "Well, I don't know what that is." So at the end of the day, we finished our shift. And we said, "Dave, what is that?" He says, "Oh, yeah, it's joint mobilization and manipulation." I'm like, "Oh, what's that?" And it's like, "Well, it's like the specialized manual therapy that I teach and I learned at the Manual Therapy Institute, and I'm fellowship trained, and that's what we do." And his results were amazing. Like, he would get patients better like that. I said, "Okay, can you teach us that?" I said, "Yeah, sure." So every Tuesday for about a year, we did like a 2-hour class with him. He kind of taught us everything that he knew. And then eventually he said, "You know, Travis, this is good, but I think you should go on and do the schooling." So I went to the Manual Therapy Institute. I'm fellowship trained in manual therapy, which just means PTs love alphabet soup after their name. More letters after the name, the better. Ton of letters after my name, but the important point is that I went to school for 2.5 years, and then I did a 2.5-year fellowship down in the King of Prussia with my mentor, who taught me everything that I know now, and now I teach that to everybody else. So I teach it all my therapists, obviously, but then I teach that at local universities and classes. And you know, my goal right now, and my main role is as an educator, right? So I educate my PTs. We have probably 20 students that rotate through our offices every year. I educate you guys as the most important part of my education. So this is the most important thing that I do. I've got to get you guys to learn how to use the spine, and now I'm down to like 40 minutes now. So I've only got 40 minutes left to teach you guys how to do this. And this is kind of where like my passion is, right? So that's kind of where we are at right now. So let's go over a couple things. So first thing that we're gonna go over, and oh yeah, just to kind of finish up that story. So I do all that training, right? So now what does our success rate look like? So now about 93% of our patients with low back pain, complete recovery, accomplish all their goals, they do great. And still about 5 to 7, I can't fix everybody, right? I still think I can. Going into every evaluation, I'm like, I'm gonna fix this. I don't do it every time. Sometimes we need other people to help us. So we partner with chiropractors and massage therapists and acupuncturists and orthopedists. And if we can't fix you, we're gonna find a way to fix you. But for the most part, most mechanical low back pain, the most common stuff that comes through our door, 93% of that should be fixed pretty easily with physical therapy. All right, next section here. What is sciatica? Anybody ever heard of sciatica? Yeah. Anybody know what it is? Go ahead.
It's a nerve that goes down from your spine down your leg.
Yeah, ooh, you're filling out the next part already. So sciatica is kind of like a garbage pail term that we use for any pain that goes down your leg. Anybody that has pain that goes down your leg, that's sciatica. Okay? It can be caused by a lot of different things that we'll talk about, but basically it's involving the sciatic nerve, which is exactly what you're saying. So the sciatic nerve is the what nerve in the body? What do you think? Longest or largest, right? Yep, both of those things. It's the thickness of your thumb. Okay? So this nerve that goes down the back of your leg, it's really big, okay? Because it has a lot of information that it needs to send from your brain to your lower extremity. So it's huge. Okay? So the disadvantage of that is it's pretty easy to have pressure on that nerve, which we'll talk about. So in here it's actually 2 nerves. Okay? So the nerve comes down and right above your knee, it splits off into 2 smaller nerves. So it's your peroneal nerve, which goes down the outside of your leg, and then your tibial nerve goes down the inside of your leg, and it turns on a bunch of other nerves in the bottom of your foot. But for the most part, we're going to focus on this big one that's in the back of the leg, because that's the most commonly irritated nerve. So next here it says it travels from the low back, like we talked about, down the back of the leg into the foot. So it's a bundle of nerves that come off of your lumbar spine. So your lumbar spine is your lower back. There's 5 segments in your lumbar spine. The nerve roots come off of each segment, and then they come together and make this big nerve that goes down the back of your leg. Sciatica sufferers may experience what numbness or what in the leg, do you think?
Tingling.
Okay, tingling and pain. Yeah, I heard both of them. So pain, numbness, tingling. Hey, if you have come into my office and you say, yeah, I have pain or numbness and or tingling down the back of my leg, you have some kind of sciatic nerve irritation. Now what's causing that and finding the cause of that is the most important part, which we'll talk about. Okay, now this question here. Is the pain, numbness, or tingling reproducible? Okay, so this is the next most important question that we ask in an evaluation. Reproducible, right? So we're like, what does that mean? It means, can you do something that makes this pain worse or better? Or some people come in and said, I have no pain when I sit, I'm fine, but then when I do this, that produces my pain. If you can do that, if you can say that, then I can fix your back pain. Okay? If you come in, go ahead.
Can I say that? Because that's what I have. But anything I do, it hurts.
Okay.
Laying, sitting, walking, bending,
Any of those worse or better than the other?
laying
Okay.
is worse.
So right now, 0 to 10, what's your back pain? 0 no pain
It's
section.
not real bad now.
Not real bad now, but it will get worse.
Down my leg and it goes down the front, though, from the back
Yep.
down to the front.
Okay. Yep. So it changes.
Yes.
Yes. Okay. That's what I want to hear. Because if someone comes in and says, I have back pain, 8 out of 10, stays at 8 out of 10, no matter what I do, from the moment I wake up to the moment I go to bed, like, you're not staying in my office very long. You're going to the hospital. Okay? So that happens a couple times a year. It's rare. Most people have back pain like this, where it's like, yeah, really bad when I sit. When I stand up and walk, it feels okay. There are periods of time where I have no pain, or they'll say, I always have like this low-level ache kind of a pain. But if there's things that you can do to reproduce the pain, then that's usually pretty easily fixed in physical therapy. So that's important to know. So in here it says if the pain, Numbness tingling is reproducible, it's likely reducible. So it means if you have pain that you can reproduce, we can probably fix that. Okay. So I want you guys to fill this next section out according to your low back pain. If you're not having low back pain now, think to a time when you had low back pain and just kind of fill that out. So I have pain with standing, walking, sitting, lifting, changing positions. So this can be, typically someone will come in and say, yeah, when I change positions in bed, like roll side to side, then I get some back pain. Or changing positions, if I'm sitting in my car and then I go to stand up, like getting in and out of a car, getting out of a seat at a restaurant or something like that, changing positions. Golf or tennis, so these are my rotational athletes. So some people, yeah, I don't have too much back pain, but when like I go to swing like a golf club or a tennis racket, yeah, then I really get it. So if that's bothering you, then do that. Running, if you're having pain when you're running, circle that. Getting into a comfortable position to sleep at night. Anybody's back pain get worse as they get towards the end of the day? Okay. So getting into a comfortable position to sleep, that's usually because of that. And then first thing in the morning, anybody have back pain that's bad in the morning or really stiff in the morning? Yeah. Okay, so that's it, then do that. Or yeah, kind of like at the end of the day. That's important. Okay, so you got that circled. Okay, so now this is the interactive part of the workshop. So if you don't feel comfortable doing this, you don't have to. But if you want to get involved and kind of find out what's causing your back pain, then go ahead and stand up. And we're just going to do a quick, we call this a motion diagram in physical therapy. So we look at the quantity of motion, quality of motion. For now, I just want to know if these motions make your back pain worse or better. So we're looking for that reproducible part, right? So what you're going to do is you're going to stand up, you're going to keep your legs straight, and you're just going to bend forward down to your toes. Okay? So go as far as you can go. If you start to have back pain, then stop. Don't irritate it. Right? But just kind of see what happens to your back pain if you have it. Does the back pain get worse? Sometimes it gets better. Okay? So does that make your back pain worse or better? Okay, go ahead and stand up. Okay? And now just kind of think of that because you're going to write it down next. Okay? Next thing you're going to do is the opposite motion. So that's called flexion when you bend forward. Extension is bending backward. Right? So hands to your hips, and then just extend backward as far as you want to go. So what does that do to your pain? Maybe it makes it better. Maybe it makes it worse. Just remember that. Okay, now we're going to go side to side. So hands on your side like this. Okay, slide your right hand. I'm going to test you now. Slide your right hand down your side. All should be going the same direction. There you go. Okay. Good. And then come back up. And now do the same thing on the other side. Left hand down your side. Does that change your pain?
That makes it worse.
Okay. Who said that? That makes it worse.
Not for me.
Okay. All right. You want to come up here? I'll fix your back pain. All right. All right. So you guys can sit down, write down any notes that you had, and some people will have pain with all of those motions. If you have pain with all of those motions, think back and see if there's one that was especially bad. Are you coming up?
Oh,
no, I wasn't kidding.
Yeah.
All right. So tell us. You've told us a little bit about your back pain, right? So it gets worse with different things. Right? Yeah,
I had an X-ray and I have degeneration. Second.
Okay, degenerative disc. Anybody have an X-ray MRI that say that?
Mine's in my hips.
Okay,
and
hips.
in the lower L4, L5, and L5S1.
Yep. If you get an MRI, 95% chance that the finding is going to be something L4, L5, L5S1. That's where 95% of problems occur. What's that?
Wow.
Yeah. Yep.
95%.
Yep. That's where every problem occurs. Go ahead.
What is L5?
L4, L5, L5S1. We're going to go over that when we do the anatomy part, I promise. So we'll go over that. Yeah.
Travis, isn't it true that most people as we age get some degeneration in our
Everybody.
spine?
If you're over the age of 30 and you get an MRI or an X-ray, I've never seen one that I look at and says, looks good. Never seen it. Okay, there's a finding on every single X-ray. Okay?
Does everybody shrink as they get
Everybody shrinks. We're going to talk about that too. Anybody taller now than they were when they were in their 20s? No? Okay. Part of that process is the discs that are in between each segment. They'll lose some of their water content, and part of the process is the actual segments will lose some of their heights, and that's why that happens. Yeah, most of it is due to posture, though. So poor posture, like that, getting out of neutral spine, this will make you a lot shorter. Okay? Right. Cool. Other questions?
What's your thought about inversion?
Inversion tables? We'll talk about that. For some populations, it can be good. So everybody know what an inversion table is? Hook in, flip you upside down, right? What does that do? It kind of takes pressure off of the discs. You've probably also seen that in traction tables. We have traction tables in some of our offices. Decompression.
Decompression.
Yep.
Decompression.
Okay,
From a
decompression,
chiropractor.
typically from a chiropractor. Yep, so that's just kind of decompression, kind of pulling apart the spine to add some space in there. The carryover effect of that, for me, is not great. Okay? So you might feel good for a short period of time after you do that, but gravity is still going to come back to you the next morning, so it's going to kind of push it. If you do decompression and it makes the pain better, I'm all for it. Okay? So some people have great results with it. Some people do it, have some short-term effects and get better, and some people don't get better at all. If I told you, if you came into me and said, you know what, Travis, I've been trying something new. I've been doing the PT stuff, and I stand in the corner in my house on my head for 10 minutes a day, and my back pain gets better. You know what I'm going to tell you? You should probably do that. That's a really good idea. So everybody is different. Okay? It's not really common, but let's give you an extreme example. If you're doing something that's making your low back pain and it's not affecting you negatively in another way, you should probably do that. It's a pretty good idea. Yeah. So, go ahead, you had a question?
Yeah, I just wondered if it's too early to bring up stenosis.
Yeah, so we're going to go over that. Yeah, so we'll get to that too. Okay. All right, so what, of all the activities, you said a lot of activities make the pain worse. Which activity irritates it the most, do you think?
Types of exercise I try to do, and I do ones that I feel are easier for me that don't hurt.
Mhm.
They don't hurt when I do them, but after a
Afterwards.
while, then I'm really sore.
Okay, all right. So when you were doing the motion here, which one bothered you the most?
Well, the degeneration is worse in my left hip than my right.
Okay.
So when I went left, I feel it
Okay.
a little bit more.
Okay.
Pain, just a little.
So we'll go over this quickly. One of the reasons I don't love X-rays and MRIs, this is like sacrilegious, but because now she's identified with that. Okay, so she knows that I have a more degeneration in my hip and my back on this side. So automatically, I'm going to think this is problems here. I have plenty of people that have a completely degenerated right hip, no hip pain, left hip looks great on MRI, and this is where the pain is. Okay? So don't get married to your diagnostic findings. In my MRI, it says I have 2 herniated discs and severe arthritis, L4, L5, L5S1. I have no back pain. Okay? So it's more important kind of what
Can you say that again, please?
What's that?
What you just said.
So I have a herniated discs, L4, L5, L5S1, because that's where most problems occur. Okay? I have severe arthritis in my back, and I have no back pain. Okay? So my diagnostic for that.
What is the MRI? What does that have to do with the MRI?
That's what the MRI says. Okay? My emotion and how I feel says something different. Okay? So now she's kind of thinking, well, I'm supposed to have pain on this side because my diagnostic findings have said I have this problem on this side, which is super common. Okay?
You're right.
So let's not get married to that.
I understand what you're saying, I truly do. But I'm a Reiki master, and when I do Reiki, I picture my spine healing, regrowing cartilage over the degeneration.
Yeah.
I try to do that,
Yeah.
and it really does help.
Yep. And that's another thing. So for some people that might seem, I don't know about that. If that helps you, then you should do more of that. So that's perfect. Okay, so you said kind of bending to this side
Yeah.
made the pain worse. Okay, so
Yeah.
come stand here. And made the pain worse in your hip or in your back? Right there.
Right in here.
Okay, so, and when you went to this side, it didn't bother too much?
No, not
Okay.
at all.
All right, so now do this again. So kind of go down here. Give me an idea, 0 to 10. What number is the pain when you get down there?
3 or 4.
3 or 4. Okay, come back up. Okay, so now I want you to do the same thing. So go ahead and bend to the side.
To the left?
Left, yep, correct, yeah. And worse, better, same.
Better.
Okay. All right, so what did I do?
You pushed on something.
I pushed on something, right? Okay, so why did that get better? When I do, all I do is this, right?
Compression?
Right, so I didn't strengthen the muscles. I did the job that the muscles are supposed to do.
Oh.
Right? So when she bends to the side, the muscular control here is not good enough to have that happen in a healthy environment. But when I do it, oh yeah, it feels a bit. Now, did it take the pain completely away?
Yeah.
Okay. That's more common than you think. Okay? So what did I just did the job that the muscles are supposed to do. So if I can just train her muscles to do that, then the problem's going to get fixed. It really sometimes is that simple. And now she's had back pain, severe back pain for a long period of time. So for me to say, yeah, all you gotta do is shrink those muscles, that's not realistic. That doesn't sound realistic. A lot of times it is. What I want you guys to know is the spine, when people think of spine, they think of a very complicated structure that has a lot of things going on. And that is true. But sometimes the fixes for it are not that complicated.
So what you're saying is that actually the muscles need to be stronger and healthier
Right.
to help with the back
Which
issues.
is also in her mind, she's like, well, I do exercises. Like, I do the exercises and then my pain gets worse. Okay, is she doing the right exercises? Is she doing it in the right form? Movement is important. Any kind of movement is good. So she's doing that. Are she doing the right things at the right prescription?
Mhm.
Anybody get a prescription from their doctor ever? Like for pills? Okay, all right. So is that prescription important? Like, if it said take one a day for 10 days, if you just started, oh, you know what I could do? Just take all 10 of them today. It's a good idea. No, right? So the prescription is really important. So the prescription in exercise is, first, are you taking the right exercise? Which sounds weird to hear, but are you taking the right pills? Like if I have high blood pressure and I'm taking high cholesterol medicine, sometimes it works, but not a good idea. So am I doing the right thing? And am I taking it at the right frequency? Am I doing it the right amount of times per day, the right number of days per week? And there's a ton of variation in that. That's why, I mean, physical therapists now are doctors. We have to go get our doctorate to be a physical therapist. So prescription of that kind of stuff is really, really important. And a lot of times it's not done correctly.
That's very interesting.
Yeah.
The
Make
right
sense?
sign, yeah,
Yeah.
I get it.
All right. Thanks for coming up.
Thank you.
Yeah. All right. So let's keep going here on our sheet. All right. So now it says the number one single biggest mistake that sciatica and low back pain sufferers make is they do what? Ignore it, right? So that's really common. So down here, what are your options if you have low back pain? The first one there is you can ignore it. Do you guys want the fire alarm analogy or the leaky roof analogy? Someone's got to pick.
Leaky roof.
Leaky roof. All right, everybody have a leaky roof? All right, so when I first moved into my house, it was new construction, and I had a bad rainstorm, and I look at my ceiling, and it's sheetrock ceiling, and now I've got a watermark there, right? So I even know what happened. Like the guys didn't put the flashing on the pipes that come out of the top, right? So I'm like, yeah, I should get around to that. Next rainstorm comes, gets a little bit bigger. My house works, right? I go in, the lights turn on, refrigerator works, electric's there. It's fine, it's working properly, but every time it rains, it gets a little bit bigger. And then one morning, at about 3 a.m., I hear a lot of noise downstairs, and it is raining really hard. And I go downstairs, and now that leak has run from that spot there, gone down my wall, and then it's popped up all the floorboards in my kitchen. Right? So I had probably, I don't know, I should have got up on my roof, but I probably had a $200 problem. Hey man, can you come back and can you just fix the flashing here so I don't have this problem? Now I've got a $20,000 problem because I've got to replace all the floors, I've got to replace the sheetrock in the side. So I ignored it, right? I ignored it, and now I had a bigger problem. So that's really common with low back pain. A lot of people are, like you said, are walking around with low back pain. You guys walked in here, right? But it's not optimal. So you guys can get away with back pain for a really long period of time, but unfortunately sometimes it's rare, but someone comes in and the back pain has gotten so bad that we try as hard as we can, and this is kind of like this small percentage here, right? Like severe degeneration, multiple levels, that becomes a surgical candidate. The surgeons that we work with, they're trying to not do surgery as much as possible, right? At least the ones we work with. Some surgeons want to do everything surgery. But then it becomes that kind of a problem. And we see great results with our spine surgeries. Sometimes we don't. Okay? So the point is, you don't want to ignore these problems. You want to kind of take care of them on the front end, or else you have bigger problems. The next thing you can do is you can alter it. So number 2 is alter it. So anybody ever take pain medication for their back? Yeah? Okay. Anybody ever have success with that? Like, does it take the pain away? Yeah, it can. Sure.
Just
Sure.
the inflammation.
Yeah. So it can take the inflammation away, which can in turn somewhat take the pain away, right? But typically, what happens? Once the medication wears off, then the pain comes back. Right? So now I'm not saying I'm against all medication. It's severely overused, and if you don't know that we have an opioid problem in this country, then you probably haven't been watching the news that much. It's a really serious problem, right? So go ahead.
Yeah, Robert, I was taking Tramadol.
Mm-hmm. Yeah, that's for nerve pain.
It worked, but I did not like the side effects of it.
Yep.
Really, it's an opioid.
Mm-hmm.
Yeah.
Yep. So
But,
that's
it's only a bandage.
Mhm.
It's
Yeah.
only a bandage.
Right.
You have to go to a PT.
Yeah.
I gave all pain medications I can't end up with stomach problems over taken it, so I haven't taken any pain medication in several years, and I've come to the conclusion that if you take a pain medication to make the hide the pain is telling you that something's wrong with your body.
Right.
And how do you know if you've been healing or if you got something wrong if you're taking opioids to hide it?
Yep. So it's kind of like the check engine light.
Yeah, it's
Right?
a check engine light. Yeah, I'll just put black tape over it so I can't see it.
Right.
I do that. Yeah.
That's an analogy.
Yeah. So you can do that, but if you don't take care of the actual cause of the problem, then you're going to run into problems further along. The other go ahead.
Well, okay, you're gonna address the back brace.
Yeah, back brace. So perfect. So we came up here. What did I do? We went stabilize. Oh, it feels better. Putting a back brace on is one of the most effective things you can do for severe acute low back pain. Okay, for a short period of time. You guys ever go to hardware stores and see the guys with the back braces? Okay, so you fill out your intake paperwork and they give you a back brace. Okay? So I never see those guys and girls coming in and saying, yeah, I was picking up a pallet and I hurt my back. Never. You know when I see them?
When they're at home.
When they're at home, they took their back brace off and they went to untie their boot. Every single time. Okay? So that back brace, if you want to wear it for the rest of your life, 24 hours a day, 7 days a week, you might not run into trouble. The problem is that back brace is doing the job that the muscles are supposed to do. Same thing, I was doing the job that the muscles were supposed to do. Well, if you want to pay me to walk around like this all day, then I'm very expensive, but you can do that. Or you can kind of strengthen up the muscles, right? So again, I'm not against all uses of bracing and for low back pain, but man, I want to try to get off of that as quick as possible, because as soon as your body relies on that, your body's an efficiency machine. So if you're going to do something for your body's like, great, I don't got to do that anymore. So if I'm providing the stability with a brace, the muscles are, yep, I'm not going to do that anymore. And you can see, you can look into tons of studies on MRI. So one of the things that MRI is useful for is you can see the size of muscles. So the muscles that stabilize the spine back here, you can see side-by-side comparisons of people that typically use a back brace and people that don't. And every single time, those muscles are smaller. So if they're smaller, they can't produce the power to stabilize those joints, and that's where the problem occurs. Okay? So you can alter it. Okay? And again, for those two examples that we gave, I'm not against all use of that. I just want it to be as short a term as possible, because you've got to get your body to do the job that the muscles need to do in order to kind of stabilize the spine. Go ahead.
Yes, I have a back brace at home, and before I came to Robbins, West, and Bethlehem, I was thinking maybe I should just wear this back brace and it'll go away. But now I find out it's not really the greatest thing in the world.
Yeah. So short-term use of that. So let's say, oh, I got a lot of yard work I want to do. I'm going to be out there for like an hour. That I'm okay with. I would like to kind of test you and see if you can do that on your own without it. But like all-day use of that is what we need to kind of stay away from. Yeah.
So how long of a use are you saying?
We're trying to get rid of it as soon as possible. So
Because I mean, they're in the process of getting me back.
Okay. Yep.
And when I tried it on, oh my God.
Right. So
It was like night and day.
So it feels good.
Yeah.
For me, you can go a couple different ways with that. Okay. If you feel great and you wear that, and that makes your life significantly better, I'm not going to tell you to not use that. I just want you to know that.
Yeah, I mean, I know it's not.
Yeah. I want you. Okay, do that, but we're going to try to get away from that as quickly as we can, because we want your muscles to be doing the job of stabilizing the spine. Go ahead.
Okay, so quick question. Today when we're outside shoveling snow.
What snow?
And I
Hire
want you to
somebody.
shovel snow, hold that pole on your back thing, which is really good. But for those with back pain, maybe today we should use it for the 2 hours we shovel the snow.
Yeah. So if you guys are having back pain, you've got to shovel snow, and you said, hey, I got to put a back brace on. If you've got that, I would strongly recommend that. Okay, just not all day use of it, but that's a good example. Yep.
Because I have neuropathy, I recently got braces so that I could keep my balance better and avoid tripping. I've noticed now when I take the braces off, walking is really difficult. Should I avoid the braces because then I can keep those muscles active?
That will happen with any kind of bracing. Back brace, leg brace, arm braces. Your body will start to rely on that. Okay? So you're asking, I got to do an evaluation on you to kind of find out what's going on. But in general, I want to try to get you to use those as little as you possibly need to. If you're in a situation where your balance, you're going to be in a situation where you might have a fall and balance is a huge issue, yes, put those on. But to put them on in the morning, have them all day, and then take them off at night, I'm really not okay with that in most situations. Now we might do an evaluation of, yep, this is what you've got, this is what to deal with. I want to try to see what I can do to help the neuropathy first, and then see if we can move away from the brace. In general, I'm trying to get you off of braces as quickly as possible. Yeah, that's a good question. All right, last thing, number 3, is you can fix it. Most low back pain is mechanical in nature. So that's why we take biomechanics and physics in physical therapy schools. So you've got to learn how levers work and how muscles activate and how things work. Most low back pain is pretty mechanical. You fix the mechanical problem and the pain goes away. So next here, the 3 common causes of low back pain and sciatica. So number 1 is herniated what? Anybody know what that is?
Yes.
This. All right, you guys know it's fun. So now we're going to go over a little bit of the anatomy. So I get to draw now. What I really wanted to do when I was in high school, and I'm talking to one of my kids now about it, is I wanted to be an art major. But as it turns out, I wasn't good enough. And my mom didn't really like that as a career path. So I kind of fell into physical therapy. But I like doing these drawings. All right, anybody know what I'm drawing? A disc right here. Okay, so this is the disc. And what's this and this? Vertebrae. Holy cow, you guys are good. Okay, L4, L5, and then S1 is down here. Right? So this is where all problems occur. We talked about that. Right? What is the job of the disc? Cushion. Okay. It does do that, but it's not its most important job. Its job is that it's a ligament. Does anybody know what a ligament is? Ligament attaches bone to bone. Okay? So different than a tendon. Okay? So tendon, you guys know what an Achilles tendon is? This big tendon in the back here, you grab onto it, right? That attaches my calf to my calcaneus. Okay? So that's a tendon. A ligament attaches bone to bone. Think of it like a rubber band. Okay? Anybody ever sprain their ankle? Okay, what happens when you sprain your ankle? Is that you do it one time and it never happens again? No, you typically do it over and over again. Why does that happen? There's 3 main ligaments that are on the outside of the ankle, and when you stretch those out, even when you do physical therapy and you get the muscle stronger around them, they're never going to go back to their original length. Sometimes you completely tear them, right? And then you have nothing there. So now you have an issue where it moves too much. It's wobbly, right? So think of that, and now think of this. If this is a ligament, this attaches L4 to L5. If I have some kind of problem here, some kind of herniation, bulge, irritation, it's not doing the job that it's supposed to do, what's going to happen between these 2 segments? Okay, so it's going to get closer, yes, and it's going to move excessively. Okay, so this attaches this to this. So, you want some motion. If this is normal motion, we want that to move a little bit. If it didn't move at all, that would be a fusion. Okay, has anybody ever heard of a spine fusion? Okay, that's like last resort. This thing's moving too much. You've failed conservative therapy. Maybe you didn't get the right kind of therapy. And you have to close that down. When you stop the motion there, that typically will take care of the pain. The problem is, now the segments above and below that have to move excessively to make up for this lack of motion. Okay? But in general, you want this to move a little bit. If it moves too much, that's a problem. Okay? So now in your spine, L4, L5 is moving too much. Okay? So what happens is you have irritation there. So what is this? Nerves. Yes, this is your spinal cord, right? Off of the spinal cord come the spinal nerve roots. These are the nerves that kind of come together, and then they make your sciatic nerve. Excessive motion here will cause inflammation right here. Okay? If you have some kind of disc herniation, this disc material will actually push out, and it will put pressure on the nerve. Okay? Any kind of pressure on a nerve, even light pressure, will cause nerve symptoms. Numbness, tingling, burning, pain, decrease in muscle function. Okay? So if you have irritation here, puts pressure there, can cause pain here, can cause pain further down the leg. But what I want you to kind of get a really good appreciation of is this is a ligament. It attaches L4 to L5. When you have some kind of irritation there, some kind of essentially rolling your ankle, you're going to have excessive motion. Okay? So the good news is, if you have good strength of the muscles around that, you can overcome that. There's plenty of people walking around with really ugly looking MRIs that have no back pain, myself included. Okay? But I know how to use my body to stabilize this, good posture, all the stuff we talked about up here, hip mobility, nerve mobility, okay, neutral spine. I have the education for that. Okay? So it's my job to get you guys to have the education for that. So that's all the information on disc. Here, pain with bending which way. So think about this, and you'll hear a jelly donut analogy with discs commonly. I'm not in love with that, but let's go with it. So if this is me, this is the front of me, this is the back of me, where am I going to have more pain? When I bend over like this or when I bend backwards?
Forward.
Forward. Why? Because when I bend forward, I put pressure on the front of this disc,
It squeezes.
and then it pushes the material that way. In a really active disc, like if you had a disc herniation like yesterday, and someone comes in, like even bending forward, they'll have pain, and they specifically like shoot right down the leg. Most people won't. I won't get them that quickly, unfortunately. I get them typically 6 or 9 months later after they've had gone to the doctor, gotten medication, gone to see ortho, gotten diagnostic testing. It takes a while for them to get into my office. But for the most part, if you bend forward with this, then you're going to have more pain. So that makes sense biomechanically, right? So I put pressure here, the disc, or even like an irritation, like an inflammation, we'll put pressure there, causes increase in pain. So usually age what or younger, do you think? Usually age 40 or younger, okay? But once you get a little bit older, like we talked about, then what happens? This disc material loses some of its water content. So you get a little bit shorter, right? The good news about that is that you tend to have less disc problems because now that material doesn't move quite as much. So as you get older, you typically don't have this one. This is typically people 40 or younger. Okay? I've seen it in people 65, 75 that have problems with that. But for the most part, it's going to be people that are younger. So the second one here, so we're going to talk about arthritis here. Stenosis, DDD. Anybody know what that stands for? Degenerative disc disease. Going to see that a lot on MRIs. The most common term is just arthritis. You go to the doctor, they did an X-ray, and they say you have arthritis. Okay? So arthritis is just how much space is between here and here. If it's less than other segments, you have arthritis. Same thing with your hip. Okay? So you had hip X-ray, right? So ball and socket joint. How much space is between here and here? If there's a lot of space, you don't have arthritis. If there's a little bit of space, it means the cartilage has worn away. That connective tissue, same thing. This is kind of worn away. And now there's less space there. That's all arthritis is. This is going to be pain with what or what, do you think? So when someone has stenosis, what do they have pain with?
The lower.
Pain, well, yep, they have it typically in the lower back, but you can have it in the neck too. Pain with standing or walking, okay? That is relieved with sitting. Anybody ever seen anybody at the grocery store that's like bent over their cart like this and walking like that?
Yeah.
Okay, so why do they do that?
Feels better.
Feels better, exactly, right? So this is a better position. Your body is way smarter than you are. It will put you in a position to decrease your pain. So, but I want you to understand what's happening. If we have arthritis, so maybe these discs are a little bit smaller, maybe we had an old disc injury that was 20 years ago, and now the space between here and here is less. So the nerve root that has to come out of here and go down the spine has less space to go through. It's called a vertebral foramen. So it's the hole that's made when two segments come together. There's a little hole where that nerve goes out and goes down the back of your leg. If this gets less, that hole goes from this to this. There's less room for error. What can I do to make that bigger?
Yeah.
I can bend forward, right? So I can bend forward. It opens that segment up, and that's why they do better. Or someone with stenosis, if you're over the age of 65, you have pain that gets worse with walking, and you sit, and the pain goes away after a short period of time, you have stenosis. So all that means is you need to make mechanical changes in the way that you do things in order to relieve the pain. Go ahead, Dan. From here, they go to the side. Okay, so now we're kind of taking this picture and going this way with it. Okay, so here's my lumbar spine. These nerves go down the back of my leg. And if you want to do it from the back, the reverse way, nerves come up the leg here, they go into the spine, they go up my spinal cord, and they go into my brain. Okay. All right. SI joint dysfunction, or SI joint, anybody know what the SI joint is? Go ahead.
You have nerves on both sides.
Yeah, they go both sides.
Two nerves.
Yep.
I had both nerves burnt off in L3, L4, and L5, and I still had back problems with spasm. How can that be possible? I got no nerves there anymore. I mean, they grow back after a year.
Yeah, so they looked at the problem, diagnostic testing, and they said this is the fix, and it didn't work. Anybody ever hear that happening? It's because that's what wasn't causing your
That's what
problem.
happened,
Yeah, but that wasn't causing your problem.
Oh.
So we see this commonly, unfortunately. Someone says, oh, I have terrible knee pain. So you go to your doctor, what's going to happen? They're going to do an x-ray. You look at the x-ray, yep. The space in between your tibia and your fibula is smaller. Or your tibia and your femur, sorry, is small. You have arthritis there. Pain in my knee, arthritis, what are we going to do?
Knee replacement.
Going to get a knee replacement. Okay? Patient comes in, oh yeah, I got a bad knee, I got to get a knee replacement. Like, oh, okay. We'll see them, yeah, they get their knee replacement. Knee replacement therapy goes great. Okay, after 3 months, they're good, back to normal. Still have the same exact knee pain. Why is that? It's because that arthritis wasn't causing that knee pain. It's coming from your back. Okay? That's why when you come in, anything from here down, we're doing a full lumbar evaluation. There's a very good chance that pain somewhere down in your leg is coming from your back. Okay? A lot of the times, that's what happens. So I want to try to avoid, but that's kind of how it works, right? So you go to the doctor, they do diagnostic testing. The diagnostic testing says this is the problem. And then you have a procedure, and it doesn't work. It's because that wasn't a problem. Yep. Go ahead.
Yeah, I mean, well, I had kind of two. I tore the cartilage in this knee, and they had to remove it because they couldn't fix it. Well, then I ended up getting the gel stuff put in.
Yep.
Which took care of my knee. I mean, I haven't had any problems with it since.
Great.
But I've had both hips replaced.
Okay.
And then you're talking about the back too. I have arthritis, they say, in my ribs here. I had severe pain. I honestly thought I was having a heart attack. And that pain went straight through.
Yeah.
So it was not only in the front, it was in the back.
Yeah, costochondritis. So you can have arthritis in any part of your body. Less common here than like in your hip or your knee or back, but they can have all it is, arthritis is, they look at the diagnostic testing, what's the space in between the two bones that come together that make the joint. Yeah.
Yeah, and they gave me nitro, it didn't do anything.
Yeah, rib pain, you want to have something that's painful, like rib pain, you fracture a rib or get costochondritis, like breathing,
yeah, I've done
if you have to
that.
cough or sneeze, that's terrible. So, okay, SI joint. Anybody know what the SI joint is? Sacroiliac joint. This is kind of, it's one of the funnest things we treat because it's usually pretty easy to fix. But your sacrum is your tailbone, right? So your tailbone comes down and it wedges in between your two iliums. So you got a right ilium and a left ilium, right? And that's your SI joint. So you'll have arthritis and disc problems. Almost always they come with this problem, some kind of SI joint problem. More common in females because their chemical makeup is a little bit different than males. More common in females who've had pregnancy, and if you have had multiple pregnancy, you're going to have an SI joint problem. It's like you just sign yourself up for that. So, problem is ages what to what, do you think? This is kind of a trick question. So it's 9 to 90. So I've treated 9-year-olds with SI joint problems, okay, gymnasts, that kind of stuff, and I've treated 90-year-olds. Now, as you get older, you're going to have less of a chance of having an SI joint problem because same thing, you lose kind of some of the water content in the SI joint, and it kind of hardens down and stabilizes where it's supposed to be. So that's another good advantage to getting older. Typically, you don't have a lot of SI joint problems. Okay? But I have seen patients that are older that have, I always tell them you have very young SI joints because they're moving around, but they kind of like that. Yep.
So wait, is that right above the coccyx?
Yep. So here's your SI joints. Okay? You got one on the right, one on the left. This so the coccyx is the bottom of the tailbone. Yep, sacrum. So it's a triangle. It's a wedge. Just goes like that. And you've got two on each side. So the problems you're going to have, someone's going to come in and say, I have pain right here. And they'll point right to their SI joint. And they'll have it just on one side usually. Right? And then we look at them and say, okay, what's their leg length? Typically, if there's a rotation here, it will cause one leg to be longer than the other. So I always say that we get a, everybody tell me you have one leg longer than the other?
Yeah.
So no problem, I'm going to fix that. And they're always like, why? Fix that? Because it really is that simple. So you do a mobilization to kind of reset the joint to make sure it's in the proper position, levels out. Okay, now, does the patient, oh, good, you're done? Yeah, come in for one visit? Typically not. There's a reason why that's not there. And typically, if you guys got on the table, 60% of you would have some kind of SI joint malalignment. Is that causing all the problems that you're having? Maybe, maybe not. But if I fixed it, if you walked out of your car and came back, it would probably fall back out because you haven't done the job of getting the muscles turned on to stabilize that. So that's what you have to do, you know, the exercises that we end up doing. Go ahead.
You've got two causes in younger patients, and then you've got one with standing and walking. You didn't address like bending backward.
So that test, bending backwards, if you have an increase in pain, that's an indication that any kind of standing or walking, when you're standing and walking, you're in extension. And then when you're sitting, you're kind of in flexion. So it's all kind of different pieces that we talk about. So if someone comes in and says, yeah, pain gets worse there, depending on their age, let's say they were younger, that's in their 20s, they probably don't have arthritis severe enough to cause a problem. It can happen, but for the most part, that's probably going to be some kind of joint dysfunction. So meaning they go like this, the facet joints are stuck, they're not moving, you push into that, it makes pain a little bit worse. They'll say, yeah, I have very specific pain right here, like one spot. I say, how big is that? Is that the size of a quarter or a softball? Oh, size of a quarter. That's a joint dysfunction. Get on the table, mobilize that, pain typically goes away. Someone says, yeah, I have pain here. Okay, how big is the pain? Oh, it's my whole back. It's kind of some down into my leg. They're 50, 60, 70, something like that. That's more kind of arthritis, stenosis type problem. Yeah?
I fell on my coccyx bone when I was 20, you know, right down on the concrete in the garage. So that, all this pain I have is in that SI joint then, what you're saying?
Is it all on one side?
Yeah, it's all on the right side.
Right.
Is
So,
that from that fall probably,
So-
you know,
right.
45 years ago?
right, so that, in your mind, you're like, wow, I've had this problem for 45 years. You could have
Yeah.
just fixed this like 45 years ago. Yeah, but you didn't know the proper the steps to take to do that, or you didn't see the right doctor or chiropractor or physician that could fix that. If you get on the table now, am I going to erase 45 years of back pain with one? I've seen it, rare. Is it just like that joint dysfunction? But now your body has made all these adaptations around that. So we have to fix the joint dysfunction, then we have to kind of recorrect the movement patterns that you put in place to kind of work around that. Again, your body is super smart. It's going to do things to work around problems that you have. A lot of physical therapy is kind of unlearning like bad habits or bad positions or things like that and kind of relearning how to use the body. So I'd be surprised if you didn't have some kind of SI joint problem. Yeah. All right, so what does successful treatment look like? So first one here is manual therapy. So if you've gone to physical therapy and nobody laid hands on you, then I would argue you didn't go to physical therapy. So that mobilization, getting things lined up properly, and making sure things are moving properly. We talked about a problem here. This is too much motion. Okay? So if there's too much motion here, especially in the spine, the segments above and below that probably don't move enough. Okay? So you've got, we call this hypermobility, so it moves too much. Hypomobility is doesn't move enough. So almost all the time, when someone has a lower lumbar hypermobility, moves too much, the upper lumbar spine is not moving enough. Okay? So we have to mobilize this, and we have to stabilize this. So we do exercises to strengthen this. We get in there with our hands and mobilize the segments that are not moving properly. So manual PT to mobilize the spine and or pelvis. Okay? So pelvis is the SI joint. So if you're having malalignments there, we have to go in there and do manual techniques to make sure it's in the proper position, and then we teach you how to stabilize that so that you don't keep coming back to us forever. Like if you have an SI joint problem and we need to mobilize it, you should not have to keep coming back for that over and over again. So you'll see this commonly in the chiropractic profession. I love chiropractors, the right kind of chiropractors. I go to chiropractors, so this isn't like a physical therapy versus chiropractic thing. But has anybody ever heard, like when we ask, oh, I get chiropractic, how long have you been doing that? Twice a week for the last 6 years. I'm like, so I don't think that's fixing the problem. Okay? So you'll never see someone come to my office twice a week for 6 years. We're trying to kind of fix the problem and educate you on how to maintain it, and then you're good. If you got a problem for something else, or sometimes the problem will reoccur, like you have back pain, sometimes it comes back. Come back and fix it. We got to re-educate on stuff. You probably weren't doing the exercise you're supposed to do. That's fine. But it's not, I'm supposed to teach you how to maintain this. This is your body. You don't need me to maintain your body. I'm your guide, right? I'm your teacher. I got to teach you like the mechanics of stuff, but you need to maintain this. So 2 is exercises to stabilize the pelvis. So we talked about this, right? Prescription. You got to take the right thing. You got to do the right exercises, and you have to do them in the right quantities and at the right times. So that's the most important thing. Very commonly, someone says, yeah, I have back pain. I went on the internet and I looked up some exercises and I did them. That might work. Okay. There's a chance that the exercises that you looked at were specific to your low back pain and it got rid of the pain. I've seen that before. It's rare. Okay? A lot of times you're not doing the right exercises at the right frequency at the right time, and sometimes it'll get better, sometimes it'll get worse. But I just can't overemphasize how important that is. Those are like pills that you would take from your doctor. The prescription of that is really important. And then the last thing, learning the 3 non-negotiables of spine health, which are, you guys all remember them? Who knows one of them? Neutral spine, right? Good posture. We talked about that. What'd your grandma say? Sit up straight. Yeah. What else? Hip mobility? Hip mobility. What's hip mobility? It's just how your hips move, right? If it doesn't move enough, then we've got to ask for more movement from our spine. And if this lower lumbar spine, which is where all the problems occur, if that has to move excessively, it's going to cause a problem. And what was the last one? Nerve mobility, right? How well do these nerves glide back and forth? If you guys can do that, if you can learn that, you won't have back pain. Okay. So, now you got to find out what you want to do. You can ignore it, right? We've already discussed that. You can walk out of here and you can ignore it and hope that it goes away. Usually doesn't. You can alter it. You can keep taking medications or bracing or other kinds of things, or you can fix it. So you guys saw an ad on Facebook or saw something in our office. You called up. You came in a snowstorm on a Saturday. You listened to me blab about low back pain for an hour. Okay? So you clearly are invested in getting rid of your low back pain. So the next step is to come in for a free screen. So anybody that comes and listens to me talk can sign up for a free screen. So a 30-minute appointment with a physical therapist. We do a full evaluation. So I'm giving you some general information. Some of you people have this exact problem. Some have the opposite problem that maybe we didn't cover enough. So the good news is you come in one-on-one with a physical therapist. We do a full evaluation. We tell you exactly what's going on. Okay? And we tell you what you can do to get rid of it. Okay? So it's absolutely free. I don't take your insurance information. We don't take any money. Unfortunately, what we see a lot in back pain treatment, which I didn't even talk about that much, it's like the most expensive thing that we treat in our society. You guys think cancer treatment is expensive and high blood pressure. We spend way more money and we lose way more money in disability in spine health than we do in anything combined. So a lot of people have spent a lot of money and not gotten results. So like, oh, okay, you're gonna tell me to come in and I'm gonna have to pay money and it might not work. No, you don't pay any money. You come in, you meet one of our therapists, and we go over what's going on, and we've got to kind of convince you that this is the way that you should go. Okay? It doesn't. Some people come in and we say, yeah, physical therapy is not the appropriate thing. We've got to send you out for some other testing or something else. Again, a majority of people, like 93%, have mechanical low back pain that's pretty easily fixed with conservative care. Okay? I'm trying to keep people from not taking injections, medications, or surgery. Again, those things, you can use those things, and and sometimes we send out for those things. Majority of the time, nah. Go ahead.
Yeah, can I offer a little testimony to everybody here?
No, and I'm going to pay you.
Here we go. When I first came there, after my evaluation, I could not hardly walk from my car into there. I could hardly walk. When I completed my graduation yesterday, I walked perfectly out to my car.
How about that?
Thank you.
Yeah. Thank you. So, if you guys want to do that, then you can find April and I up front. We'll be here for a little while. If you want to sign up for that, I would encourage you to do that. Here's what people do. Oh, yeah, I'll sign up at some other time. Like now. Sign up now. Just get a time in the schedule. Come in because you're going to go out, and then I'm going to call you. And I'm like, hey, man, you came to my talk. Said you had low back pain. You want to come in? Like, it's annoying. Just come now. Sign up for the time. Get the 30 minutes. It's free. Guys, I can't make this any easier for you to take advantage of this. It's free. Yep. Go ahead.
Do you do any seminars on next?
Oh, yeah, we do. So this is one of probably 20 talks that we do. So good question. Maybe you're more concerned about your neck pain or your shoulder pain or something else. You can come in and do a screen for that. Okay? Just let us know, and we'll schedule it. You can do a back pain one. You can do a neck one. You can do a shoulder. I don't care how many you do. Okay? My job is to get people to understand that this is the way to go. Okay? So like injections, medications, and surgery, we're trying to avoid that. Okay? So I will spend the rest of my life trying to convince people that conservative care, unless you completely fail conservative care, okay, then that's okay. You're in one of these small percentage of people. Most people fall into this. Also, you guys have a book, so I need your help. We just printed these this week. So if you read through these, this has like other specific exercises. Again, I could sit here and talk for the next 4 hours about back pain, but you guys have better stuff to do, and we got to get you out of here before the snow hits us. But there's a ton of great information in here. These are really cool. QR codes. I don't know if you guys have, anybody who has a smartphone, you just put your camera on that, and then it will take you to videos that we have. Some of this stuff is great. It works for picture. Some stuff is better on video. So there's tons of videos in here and information about what we do at Robin's Rehabilitation. If you have any questions about this. So the help is, if you look at this and like something's confusing or doesn't make sense, then I really love your feedback, because I need to kind of create a tool. Talking is great, but I need to create a tool to kind of educate people on how their spine works. So we come out with these for all different body parts. So if you have any questions or anything about this, I really appreciate your feedback. So you guys probably got emails from me. You can reply to my email, or all my contact information is on our website, so we can get some help with that. Sound good? All right. We'll be up front. If you guys want to sign up for a screen, you can come find us. Oh, applause? How about that? Thanks, guys. Seriously, thanks for coming out. I did not know this many people were going to come because of the snow, so you guys are awesome.
thought it was gonna snow at noon.